This ain't no ordinary world.
This is Rena Kennedy Lester. Welcome to Life, Hope, and All Things Kennedy, the life-building voice of wisdom. We're happy that you're here today with us as we discuss topics such as relationships, parenting, physical and mental health, finances, and life lessons. Thank you for being here today on Life, Hope, and All Things Kennedy. Hello, greetings and blessings to you, each and every one of you out there in radio land. This is Rena Kennedy Lester on All Things Kennedy. We're coming at you today where all things matter. And so we are continuing our discussion on a topic that is continuing to matter in the lives of the people today, and that is the COVID-19 and the pandemic that we are currently experiencing. I am proud to say that we have our own representative of the medical profession here that is continuing to give us updates and continuing to talk to us and to give us information about the COVID situation. And that is in the none other than Dr. Conrad Miller of Miller Family Practice. I call him my own Dr. Sanjay Gupta. Are you there, Dr. Miller?
Yes, good afternoon. How are you doing?
I am well. I am doing wonderful. And again, as always, thank you for all that you and your staff do to keep the population healthy and to continue to help to keep people out of the emergency rooms and the hospitals during this critical time. So thank you once again.
Thank you for the recognition.
Oh, you're quite welcome. So today, what I would like to do is continue to have our discussions. I have been getting lots of feedback on the discussions that we have because, right now, people are hearing so much doom and gloom and depression, on the news and everything. And I desire to bring, some light and some hope and to let people be empowered during this critical time. And so I really value the information and the knowledge that you have been able to share in terms of keeping us all informed. So what I would like to kind of focus on today, and I've called it COVID-19, I said reset and retooling. So we're going to reset our mindsets, we're going to reset our health, and then we are going to retool in terms of some tools and some things that are going to help us not only here in the COVID-19 situation, but from here on out. So do you think that's a discussion that we can have today?
Yes.
Okay. All right. So one of the first things, let's address some of the things that we can continue to do to address our health care and to continue to reset our mind and our focus on our health and how we can come out on the other side of this COVID-19 as not only survivors, but thrivers. Can you address that just a little?
Sure. Well, I'm glad you even phrased it like that because, some of us are still sheltering in place. And, of course, there have been a loosening of restrictions. But as I talk to patients, I see a lot of them still staying in. But as I'm out on the roads and in the stores and stuff, there's a lot more traffic. Mm-hmm. So regardless of whether you're staying in or whether, you've been called back to work, I just think that, this has been definitely a slowdown. This has been a time, definitely I think God is trying to get our attention, and I think those of us who have more wisdom are probably paying a bit more attention. Mm-hmm. But how can we exit this pandemic, whenever that exit is? How can we exit this pandemic better off than when we entered it?
Right.
So what are we doing with this extra time we've had? Mm-hmm. Have we learned a new skill? Have we worked on our health? Have we become closer with our family that we might be sheltered in place with? What have we done to in some way become better than the person that entered this pandemic and this shelter in place over 2 months ago. So I think we should all ask ourselves that question, and then honest answerly. Goodness, rephrase that, and then answer honestly, and make our adjustments from there.
So then, in terms of health, for instance, what are some things that we can do? Not only the medically fragile, not only the people whose immune systems are compromised, but what are some things that we can do during this time, even in our mindset about our health? For instance, we know that we have been told prior to the COVID-19 about knowing our numbers, for instance, about getting our regular preventive checkups and things of that sort. What are some things in terms of our health care that we need to go ahead and make sure that we are paying attention to, not only now, but in the future?
Well, that's a good question. So, if you are a person who does not, quotation, know your numbers, close quotation, like you just mentioned, then, now is a good time to go ahead and try to start working on those things. Because, lots of primary care offices are open, or are doing virtual visits or carside visits, or some variation on a isolation type of visit, where maybe there's isolation in the exam room or isolation in the lobby, so that individual patients can be seen face to face if a virtual visit is not appropriate. So so you should try to find out when you can get a physical done, since a lot of us are still off work or are working different and perhaps more relaxed hours than before, so it ought to be a doable thing to try to work that office visit into your schedule. Get that physical, get that lab work done, go to that office on an empty stomach, meaning don't eat food, but drink lots of water so that you are easy to draw blood from, and get these things found out so that you can start addressing them.
And so, for instance, and I'm constantly talking to you about diabetes. What is, I guess, the baseline pretty much for knowing whether or not, because there are a lot of people that I'm finding who are diabetic and don't know it. There are people who are at, I guess, borderline, and they're not taking any other additional precautions. So what are some things? Well, first, what's a good number in terms of A1C, or numbers that we should strive to maintain with a healthy or I guess controlled diabetes, and then a number for pre-diabetes, and I guess things that we can do to manage those numbers.
Okay. Well, a fasting blood sugar, meaning blood sugar that is obtained after at least 8 hours of not eating, a fasting blood sugar should be less than 100.
Okay.
And of course, sometimes that might be a few points higher if there was a really high-calorie meal the previous night, even if it was 8 or 9 hours prior. Just sometimes, if you're really eating the wrong thing, you might end up with a slightly high blood sugar that following morning. But a less than 100 would be, a very good indicator that individual is probably doing the right thing.
Okay.
Then, of course, you mentioned A1C, which is kind of a test that has a dual purpose. So it's used as a screening tool for the diagnosis of diabetes, but it's also used as a way to track a known diabetic and how good or bad those numbers are for that known and possibly treated diabetic. So for that person, for the non-diabetic, the number should be less than 5.7.
Okay.
So 5.6 on down is normal.
Okay.
For a treated and well-controlled diabetic, the number is widely accepted to be between 6 and 7 as a good number.
Okay.
And of course, beyond 7, you start. There's a higher risk for diabetic complications when it's above 7. And of course, in a treated diabetic, especially someone who's actually taking medicines, there is a risk of complications if the A1C is too low. Of course, in reality, though, the people who have A1Cs that low that are diabetic are probably diet-controlled diabetics, and their number really can't be too low as long as they're tolerating their blood sugar level.
Okay. So then this is something in terms of mindset, when resetting now, that we can control. This is something that we can come out of the COVID-19 with stronger control over in terms of our diet and either maintaining or controlling our diabetes or not becoming diabetic.
Exactly.
Now, what about our heart? Because they talk about heart health in terms of things that will keep our heart healthy. What should we do for that?
Well, heart health, comprises a lot of things. And some of them are under our control, and then of course some are not under our control. But when you first think of heart health and things we can control, we think about our blood pressure. And so those great numbers, those baseline numbers that we like to have everyone be around or be close to is 120 over 80.
Okay.
And we try to keep it simple like that. There are exceptions. If there was somebody of an exceptionally low body weight, or if there was someone, with some other factors, but for the vast majority of people, 120 over 80 is the goal number. Especially a person without medication. So we would like for you to be, air quotes, normal, close quotes, and around 120 over 80. But for the person who is at 110 over 70, okay, that's perfect. Don't eat more salt trying to raise your blood pressure up. And for perhaps a very petite individual who is perhaps smaller in height and lower in weight, some of those people are going to be like 95 over 60 or something, and that's normal for them. So again, we're not telling them to do anything to raise their blood pressure.
Okay.
But it really just kind of depends on where they are, and so those numbers that we in the medical community advertise, to the public, there are caveats to them, and we just basically, for the purpose of simplicity, we keep those more to ourselves until we're talking to that individual, rather than tell all of radio land, oh well, here are the exceptions, and then people try to group themselves. So, those discussions about what numbers are best for you should be between each individual patient and their physician. Okay,
that's good information. So then what we're saying is that your health is your wealth.
Yes, I love that. You came up with that, and I hope you patent it, and that is a great saying. And really, when all is said and done, the designer clothes, the cars, the house, you can't take any of that with you, and none of those things will help you if you're sick. If you're sick,
right. I don't know if I coined it or not, Dr. Miller. I saw it once, long time ago, but even before I saw it, I had it had come into my spirit, and so I typed it into the search bar, and I was surprised that it came up because I thought God was giving me some brand new revelation. Okay. And so basically, though, that same revelation was prevalent in even biblical times because, when the Apostle Paul was talking about I desire that you prosper and be in good health, even as your soul prospers. That analogy was pretty much made then. He pretty much could have written that verse in the Bible. Your health is your wealth.
That's true.
That's true. And that verse would have meant that not only must you be healthy in the physical realm, but you must be healthy in the spiritual realm and in the mental health realm and in all ways. So basically, that is what we're talking about. And this is something that we can all come out of this whole COVID-19 situation a lot stronger than we were in the beginning. Let me move on. Well, I put a couple of verses down. Let me look at those. And I want to kind of frame some things around these as well, because not only in our reframing and our resetting are we talking about health, but if we look at the health, then we see that Jesus gave us some examples, and there are ways that we were talking about how to deal with some pandemic type situations. They had the lepers, they had people who were at the pool trying to get in, all these different things. So we know that there were situations where masses of people had conditions. And Jesus had expectations of us as Christian people to do some things during these times. So let's look at, for instance, Matthew 25, that chapter. If I go down to verse 41, it says, "Depart from me. I was hungry, you gave me nothing to eat. Thirsty, you gave me nothing to drink. Stranger, you didn't invite me in. Naked, you didn't clothe me. Sick, you didn't come to see about me." And then verse 45 goes on to say that whatever you did not do for these, you did not do for me. So I'm looking at that in terms of even during this pandemic, this is a time for us as Christian people to be about our Father's business and not just sit around twirling our thumbs, and we're just so focused on the disease that we are helpless and feeling hopeless in terms of continuing our kingdom work. So what would you say to that in terms of Matthew 25?
Well, excuse me. We're supposed to love our neighbor,
Mm-hmm.
and so in this time, loving your neighbor could be. Well, first of all, loving your neighbor includes social distancing.
Correct.
You know, go ahead and give that extra little bit of space at the checkout line.
Mm-hmm.
It means go ahead and if you're younger and healthier, maybe let someone who is older step ahead of you in line, or maybe go do the shopping for someone who is older and maybe has a little bit more time navigating around a large store while trying to keep a mask on their nose and all these other things that we have to do nowadays.
Right.
So whatever it would take to maybe lighten somebody else's load. Saying something encouraging to the clerk who's working long hours in sticky gloves and a mask, and trying to keep safe while trying to allow you to provide for your family by being there at a store, a store that needs to be open so that you can still have batteries for your remote control or pick up your medicine or whatever else it is you're trying to accomplish. So it doesn't have to be big things, but everybody needs a kind word right now. So, it's nice when, we've had patients come in and make masks for us, or, just when somebody, asks about your day, you're busy asking about them and, are all of their needs being met? But, it's nice sometimes just for someone to say, hey, Doc, you doing okay?
Right,
right. Yeah, because we're all in this together, and we're all hearing, we're all getting bombarded with the same bad news.
Right.
And some days we accept it easier than others, So I mean, there are just a lot of things. This is a very important time that we're in. We have all these major elections coming up. It's census time, and we need to be doing our civic duty. Not only for ourselves but also for our future, because this is a very big deal from every local election to the state elections to the national level elections. So we have to be aware of all this and really making wise and spiritually based decisions like that. I mean, I think that's also to some degree a part of it. That's probably a sidebar, but it's just very important right now that we nurture and we try to nurture and love the way Jesus would love. What would Jesus do if he was walking around right now? Would he be wearing a mask, or would he be complaining that is that the mask is a violation of his freedoms in some kind of way.
Yeah, and see, that's a good point because, the Bible says that he came to show us how to live and how to deal with the issues and the things that are going on today, or, how he would handle those. And so I think in modeling health, I do believe that Jesus would have put a mask on. Yes, he is part of the Trinity, but he became flesh to come down to show us in flesh how to deal with situations. So too, yes, I believe that Jesus would have had a mask on.
Yeah.
So it's imperative, and yes, I like what you said, that wearing a mask actually shows the person that you love them as well as yourself, because you're protecting not only yourself, but you're protecting them by wearing that mask. So, yes, that behooves us. And then with the Good Samaritan, we find in Luke 10 and 25 through 37, when it was talking about being helpful. There were racial issues involved, as well as being a helper. And so we know that there's a lot of racial unrest going on, not only with the COVID situation that we got going on with health disparities and insurance and whatever, but then we've got social issues showing racial disparities. So for our mental health, how important is it that we think or pray in terms of how to handle these racial situations so that we don't become part of the problem?
Oh, I think it's vitally important. And everyday thing, literally.
Because, I think we need to seek direction in terms of how to handle a lot of the situations that are going on, because the enemy would have us to just jump out there and do the first thing that comes to our mind, and it may not necessarily be the way God would have us to handle the situation. And so then that would cause a whole lot more stress mentally than what we were initially going through. Let's see. And then James also, in James' first chapter, they talk about offerings and widows and people who are in need as well. And I think you addressed that when you were talking about, taking a meal to somebody or checking on your neighbors and things of that sort. And you did mention that. So I'm saying all that to let our audience know that we still have a responsibility as Christians, and we still have a job to do, even in the midst of this COVID-19 situation.
Yes. Yes, we do.
Okay, I wanted to segue into one last thing. We probably got about five minutes left.
Okay.
And so I want to just kind of segue into your area of profession, which is the medical profession. This is a time, we said, for retooling. We know that education is important. We know that a lot of people are losing jobs, but yet at the same time, we have young people coming along who need education and who need to be able to do some things. So technology, the medical profession, research, all of those areas are important right now. What will you say to young people now who are trying to decide on a career path, on training, a career direction to take, in terms of how important they are right now and what they can begin to do to prepare themselves?
Okay, well, that's a good question. Obviously, we have no idea what's going to happen as far as how schools are going to be taught starting in the fall. And I was just having this discussion with one of the patients this morning. I think it's going to be a great opportunity for people who are going to be starting college, because people who've already finished high school. Maybe I should just say it that way, because online classes at the college level are going to be widely available, and so someone who, maybe they had a job that hasn't fared that well during this crisis, and now they have extra time, they can start, trying to take some classes. I think it's going to be a good opportunity for all of these high school seniors who should be starting in the fall. Even if they can't be on the campus of their choice in the fall, they can still take classes online, which of course will probably be a lot more economical for their parents.
Right.
And speaking as a parent of a rising college freshman, I'm looking at that as a possible positive. But these online classes, I think, will be a good way to jumpstart your academic career. Certainly don't sit out and do nothing. Don't sit out and just be an essential worker. If your job status has changed because of COVID-19, this is the opportunity to get a little more education. This is also the opportunity to perhaps start your own business.
Right.
Something that can be done from home, or something that can be done in a limited workspace. That where you can be personally distanced from others, but still be able to make your money or do your profession in the virtual world. So I think there are plenty of opportunities here for those that kind of have some hustle, those that are kind of feeling the pulse of what this new world is going to look like. Because we're all trying to figure it out. Some things won't go away.
Right.
Some jobs, some professions won't go away. Some things are going to change.
So things like medical billing and coding would be.
Those are always fairly stable. I mean, we would hope that the way healthcare is administered would change for the better after COVID, but that's probably not going to be a quick thing.
Right.
That if anything, it might change after the election. So, but that's a whole different story.
Right.
So medical billing and coding. I ran into a patient a week ago, and she's living here and used to work for a practice here, but actually the doctor has moved away, but she still does the billing and coding for him, even though he's moved several states away. So that's a perfect example of basically she was already working virtually even before the pandemic.
Right. And so I'm saying all that to say that there are opportunities, and like you said, for people to take advantage of this and be retooling and resetting. And I also say to examine and re-examine yourself in terms of what you can be doing and how you can use this time as a benefit and not to see all of the negative things about it. The whole pandemic situation, and lastly, I'd like for you to comment on this. People keep talking about, we want things to go back the way they were and all of that, but I would venture to say that things necessarily were not all that great before, because we were complaining before COVID. We were complaining.
Right. Yeah, you're correct.
And everybody's wanting to go back. What are they wanting to go back to? Or should they take this as an opportunity to, like I said, reset, redirect, re-examine or whatever to be better and come out thriving rather than surviving and come out better than you were before?
Yes, it's funny you should say that. You're not the first person that has said something similar. You're right that how things were. Let's just say January, for the sake of argument. This wasn't a perfect world. This wasn't a perfect country back then, and nor was it perfect in January of 2019 or January of 2018.
Right.
So we can, as a society, make a decision to make this better. But the unfortunate thing is that requires for all elements of the society to agree that, things weren't that great in 2018 or 2019. And that's where, some segments of the population have 2020 vision and some don't.
Right. But we all have a responsibility. And so on our way out, what I would like to consider for us to talk about next week then is the role of the church in this COVID-19 situation.
Okay.
The role of the church in resetting and re-examination and in making sure that the congregation's health is truly their wealth, so that we will have, as the Bible says, prosperous people who are prospering even as their soul prospers. They're going to be prospering not only physically, but financially and in all areas, mentally. And COVID-19 is going to be a situation where God can show up and show out in this whole situation. God's going to show up. He's going to show out. His people are going to come out as the ones who have a platform and have some answers in this whole situation. And so I think next week, if we would talk about those things, and I love it that you are a Christian man, and you aren't afraid to talk about issues from a spiritual perspective as well as the perspective of your training and profession. So, any closing? We should
work together.
I believe so. I think we make a good team. So, any parting words, and then I'm going to pray us out, and we will be ready for next week. So, any closing comments?
Well, really, if everyone who is listening or everyone who's watching on Facebook Live, I see you. I don't know who else is watching today.
Yeah.
But if everyone, can try to take a little moment or two out of their time, to try to encourage somebody else, check on somebody else who, like, in the fraternity, we're trying to stay in contact with the people that we're not seeing. And in the church, we're trying to do the same thing. So just, somebody you haven't texted in a while, or, if you normally swing through, or if you normally have a little chat with, the cashier or someplace at some store you go to, then try to give them an encouraging word. Just try to do a little something every day to uplift somebody else. Because, really, there have been people who have been more anxious and or depressed during this pandemic season. So, just letting people know that, we're all in this together.
Be a good neighbor, in other words.
Yeah, exactly. Again, and it falls straight back to underlying biblical principles. So you're right on target.
Right. So, folks, we got work to do. The pandemic's here, but also the kingdom is still here, and we still got kingdom work to do. And from the perspective of that is the perspective that we're going to take on these broadcasts. We're not going to bring you the doom and gloom and the death rates and all of that. You can see enough of that on the news. We're going to bring you the positive perspective and let you know how you still can have an impact in this world today. And yes, Dr. Miller, you and I are going to work on this thing so that we can figure out how to get you on the Facebook too. We're going to figure that out so that you can also be on. And so now we pray and ask God just to continue to bless us, continue to be with each and every one of us, to give us godly wisdom, to give us insight, to go with our leaders and to lead and direct their path, to go with the people who make decisions every day in terms of who they come in contact with, so that they will be safe, they will protect each other and love as they love themselves. We'll wear our mask, we will sanitize, we will use our hand sanitizer, and then God, in the midst of us doing what we need to do, we pray that you will be glorified in every decision that we make. And so, thank you, Dr. Miller, for being with us today.
Thanks for having me.
I love it when you come on. The people love it. And so we're going to continue to do this so that we will continue to bring hope and emotional healing, not only physical healing, but emotional healing and hope to God's people. So until next week, y'all be blessed, be safe, and I love y'all, and we look forward to next week. So y'all take care.
This ain't no ordinary.
Thank you for experiencing the wisdom of life, hope, and all things Kennedy with his life-building attitudes and thinking from the perspective of timeless wisdom. Remember that you are valuable, you have purpose, and God has a plan for your life. Feel free to connect with me on Instagram and Facebook at All Things Kennedy. Email comments and prayer requests to allthingskennedy@gmail.com. I look forward to our next time together.
Let me tell a story about a man from Galilee.
Tell a member of your family or a friend and download from our website, thelight.live. Thelight.live.
Thank you all for watching, and we will see you on next Wednesday. Y'all be blessed.
You don't know what I've been through.